Dr. Nellen, how has COVID-19 impacted the process of coming into the hospital to deliver?
Well, I think there's lots of safety things now. Masks and hand washing and hand sanitizer and that sort of thing. So I think it's changed it a bit. I think that when pregnant women feel like they're about to deliver, they should go to the hospital earlier if they can, to make sure they can get through some of these things. We do a lot of testing for various things in pregnant women, and that should be done as well. And if a pregnant woman is about to deliver and COVID-19 positive, and that changes how the people who are in the delivery room dress and gown and shield themselves and the mom and the baby from transmission. So I think it has become a more complicated process, particularly when the mom is positive for COVID-19. But the nice thing is that, as Chris, one of the nice things that we've found so far is that the baby doesn't seem to be at high risk for getting COVID-19 from mom, even when the mom is positive. So even though the mom is positive, by doing all of these sort of protective things that we do to prevent the spread, we can usually prevent the baby from getting COVID-19. So even though we've had a fair number of COVID-19 positive moms, we've had very, very few babies that are COVID-19. I think that that's good. We don't know much about the increased risk to mom. We know even less about how COVID-19 affects babies because we have had very few cases. But I think that's a good thing. So far positive for the babies. But it has made COVID-19 and having to do all of the protective equipment and making sure we don't get transmission from mom to staff or staff to mom or anything like that. It has made it more difficult. So I do think that when pregnant women feel like they're ready to deliver, they should try to get to the hospital a little bit earlier than perhaps in the past, and know that it's going to be a little bit more difficult and that there might be more, for lack of a better term, hoops to jump through as you get settled in and that sort of thing. So I do think it has become a more complicated process.
And most of the birthing hospitals are actually testing moms. So immediately upon arrival, they will test the mom. Or if they know a mom is being induced or is scheduled for a C-section, they'll ask the mom to get tested a few days prior. I'm pretty sure all of our birthing hospitals now, I know Ohio State for sure, but I think all of the birthing hospitals right now are testing all moms at some point to see if they're positive, so that they know how to help the mom and the baby after delivery.
That kind of actually feeds into my next question pretty well. So what happens if the mom is COVID-19? Do the newborns, I assume, need to be separated from the mom for some period of time, or how do you guys handle that, Dr. Reber?
So there are different recommendations, and I can tell you what we do. We have a discussion with the mom and other caregivers and explain the situation. So we are worried that a baby could potentially get infected with COVID-19 if a mom is positive. So we do offer having them separated, mom and baby separated in some hospitals, if that's what they choose. But we would absolutely encourage the mom to pump. The reality is what's happening, and which I prefer personally as a pediatrician, is that we keep mom and baby together in the same room, but we keep them physically separated by about 6 feet, socially distanced. We continue to have mom breastfeed, but mom uses really good hand hygiene. She wears a mask while she is breastfeeding, or she's pumping and there's another caregiver with her to help give that breast milk. And that's really what we've seen a lot of moms do in some of our birthing hospitals. I can't, it's hard to imagine even being separated from your baby right after birth. Certainly there are situations where mom might be sick, or the baby might be sick, or the baby might be premature, and we have to obviously separate or take the baby to the intensive care unit, and that's a different situation. But for the most part, we're really trying to keep them together, but we have to be very cautious and make sure we're protecting the baby, making sure that, again, the mom wears a mask, she's really using good hand hygiene, she's really cleaning her pump, her breast pump equipment really diligently to make sure that, you know, it's nice and clean and it's not at risk for infecting the baby. So we give moms that option.
Dr. Gabby, would you recommend breastfeeding during this time? Because as we've just talked about, you know, everything has to be so clean. Is that sort of a concern, or do you still recommend that?
It's a concern if they don't breastfeed.
Okay.
You're not going to find many pediatricians who will say not to breastfeed.
No, we want every mother to breastfeed. You know, and really, when we're talking about minorities, and especially African American women who in the past have not chosen to breastfeed as often as we think would help protect that baby in that first year of life. So we really teach breastfeeding in every Moms to Be session almost, and encourage it. So, and Chris is a huge proponent of breastfeeding. So yes. In fact, more and more of our community health workers at Moms to Be, at Celebrate One, I'm sure, and even at Nationwide Children's Primary Care Network are lactation counselors to help that mom, because that first week is very, it can be very difficult. So having support, and we're training so many people now, everyone should breastfeed.
As a microbiologist and somebody who's taken some immunology classes, this is just sort of a question from my general curiosity. So I've learned a little bit about passive immunization through breastfeeding. Is there any evidence that you guys know of so far about if the mom has had COVID-19 and has gotten over it, would you expect, I guess, for antibodies from the virus to be passed on to the baby through breastfeeding? Because I know that's one advantage of it.
So that's what we would expect and hope, but we don't know yet.
Okay.
I look at my other partners. I don't think we have any evidence yet, or we don't know.
Okay.
We also don't have any evidence that it's been transmitted to a baby through breast milk. The infection has been transmitted to the baby through breast milk. So we feel very comfortable recommending breastfeeding. And you especially appreciate, as a microbiologist, all the benefits of breast milk to babies, and also breastfeeding to moms.